Hello, Dr. Haberman. Welcome to our podcast.
Hello, thank you for having me.
Yeah, thanks for being on the show. We're excited to have you. You're my dentist, out of full disclosure.
Mhm.
And I've been your neighbor for 20 years, out of full disclosure. And you're married to my co-host, out of full disclosure. All
Uh,
those things are true, yeah?
that is true.
Can we call you Dr. Jim?
Yes, absolutely.
Okay.
Yeah.
Well, we want to hear all about have heard all about menstruation and specifically menopause lately over
Uh,
your kitchen table and probably know more about it than most spouses and are probably more comfortable saying words that April and I use all the time than most dentists and definitely husbands.
I don't even think about it.
I know.
That's good. That is good. That's the goal for everyone. Yeah.
But
Yeah.
what many people don't know is menopause does affect oral health. And
Mm.
in all seriousness, that's what we're here to talk about today. What would you say menopause affects oral health? Like what should we keep our eyes out for on this?
Yeah. Well, so we know that, menopause, obviously, we all know that estrogen levels go down. But what we know is that estrogen is actually, we have receptors in our mouth for estrogen, and it affects basically our oral health, changes it. There's receptors that are in the gums, in the salivary glands, and in the mucosa of the mouth. So all of these factors go into change in the oral environment. And it's a very kind of complicated oral environment. And when something's disturbed, then you can have all kinds of different issues. Some of the issues I can go over now are a big one is dry mouth
Yeah.
because it does affect the salivary glands. Dry mouth is a big one. The other thing is gum disease. It
Yeah.
can cause gum disease or promote gum disease. Uh, we also find that it affects bone density. We know osteoporosis is affected by estrogen levels. So also sometimes it can change people's taste, and so a lot of women experience even like a metallic taste during menopause. The other things it also can do is increase cavities.
Hmm.
So a lot of women experience that when they go through menopause, all of a sudden they might have cavities that they never really were prone to before.
Hmm.
Interesting. So let's
Yeah.
double down on some of those.
Yeah.
Yeah.
Let's talk about dry mouth. Like what's going on there? Obviously, estrogen takes away all of the fluids around your whole body. But what's going on there, and what can we do about it? And why do
Yeah.
I care that I have a dry mouth?
Yeah. Well, first of all, it's not very comfortable.
Yeah.
So that's a big issue. But saliva is actually very important in a lot of things. So it keeps the pH balanced in our mouth, and it also helps neutralize bacterial acids, and it helps with digestion. So it's pretty important in a lot of different ways. And so people that experience dry mouth, first of all, you tend to increase your plaque and calculus buildup, which can lead to gum disease. And also, without having that neutralizing the bacteria, then that can lead to cavities too. So it's quite important in just keeping everything healthy in the mouth. It also helps wash away bacteria too, and it's got some antimicrobial properties to it too. So very important in both gum and tooth decay. Some of the things that we can do to prevent that, or well, we can't really prevent it, but there's some things that can help with that. And of course, being hydrated. That's probably number one, making sure you're hydrated. Uh,
Cheers.
yep, there you go. Perfect. So hydration, there are some salivary substitutes out there that you can use that work pretty well. And then there's also some medications if it really gets down to it. Of course, it's nice not to take medications, but in some cases, there are some medications that can stimulate saliva flow.
Okay.
Yeah.
What are, I know we talk a lot about oral health in our house
Uh-huh.
a lot. So we talk a lot about menopause. We talk a lot about oral health. And as you are just mentioning, the dry mouth and the calculus and cavities and gum disease. I'm wondering if we can talk a little bit about lifestyle management and maybe nutrition and how that comes into play with oral health and menopause as well.
Sure. So that plays a big part. So when you think about it, there's so many different aspects of that. So you've got bone density. So it's really important that we have good solid bone. If we don't, with the bone density, um, it's kind of interesting because you've got this give and take on the bone. You have some cells that take away the minerals out of the bone, and you have cells that put back. With lack of estrogen, you have less putting back, and so the
Mm.
bone density gets less. So of course, that's where our teeth are. We're with our jaws. So the lack of bone density can lead to teeth getting loose, and potentially, if it gets worse or bad enough, you could lose teeth.
Mm.
So it's very important that we have a diet that's rich in vitamin D, calcium, phosphorus, and also some other lifestyle things that are helpful too is just exercise, stimulating blood flow. That will help kind of increase that to help uh, make it a little bit just a healthier environment for the bone.
It's
Yeah.
interesting because I think people just think teeth are something and then the body's the rest, right?
Hmm.
Hmm.
And
Hmm.
what you're saying is that the all the rest of the ways you take care of yourself support your teeth. It's
Absolutely.
super
So I
important.
always look at it as the mouth is kind of the gateway, right? It's
Yeah.
like everything enters through the mouth. And so it's definitely the mouth is an indicator of your overall health. Some other things too, as far as health goes, you also want to make sure you're managing any other health issues you have, because certainly like diabetes will cause a more severe reaction to inflammation, and that can lead to bone loss and cavities in the teeth. So that's very helpful too, to manage those lifestyle. If you're a smoker, to stop smoking. Um, yeah, and just reducing stress. We know stress manifests in all kinds of different ways in the body, and so it helps to stress can reduce inflammation.
Yeah. It's glucose is a thing during menopause where you really need to be careful of your glucose levels, which
Mhm.
are, they raise for so many different ways. But what I'm hearing from you is like, yeah, all of
Uh,
it for your mouth.
Absolutely, absolutely. Everything, your mouth is just the same as anything else. You need that good, healthy lifestyle. Of course, we want, excellent oral hygiene too. There's just a lot of reasons why, and with that lack of estrogen and lack, causing the lack of saliva, it also it changes the flora, bacterial flora of the mouth too. And so it tends to be that the bacterial flora is more um, uh, in favor of the bacteria that causes tooth decay.
Sure.
So yeah, so the problem with that, so it's all kind of goes together. The lack of saliva, the bacteria. So when the bacteria produces acid, it causes cavitation of the tooth. It kind of leaches out, kind of like the bone. It leaches out the
Yeah.
minerals in the bone or in the tooth, and that causes a cavitation. It also, that acid from some bacteria can cause an inflammatory reaction where you might lose bone. It's called periodontitis. It's kind of a more severe reaction. And so that in combination with the density being less of the bone is not, favorable either. So that can lead to tooth loss. And so we're looking at just all this combination goes together uh, and affects both, like I said, the cavities, gum disease. And so that pH level, the saliva really reduces that pH level and neutralizes that bacterial acids. And so the thing with the sugar is that if you're giving the bacteria uses that sugar as their fuel source. And that's what's going to help them produce acid. Once you take in glucose or take in sugar products, and that includes carbohydrates, the bacteria will actually produce acid for 20 minutes after.
Mm.
So one of the worst things you can do is actually, let's say you're, sipping on Starbucks coffees with, all that sugar and cream and everything in there. If you're doing it all day long, then you're just giving the bacteria that food source to produce acid all day long on your tooth. And so, and you just, with that lack of saliva and the lack of neutralizing the acid, boy, it just takes a toll on everything.
Mhm.
Yeah.
Uh,
Well, we all know that you're supposed to get regular checkups from your dentist, and
mhm.
I come like clockwork every 6 months
Yes,
because I
you
don't want I don't want to have my teeth scraped so badly that it hurts me. So I come because I live in fear of that being a problem for me. But what is a regular checkup going to do to help with my teeth and bone health during menopause?
Well, so that's great. So one of the things that a checkup's going to do is we're going to be able to see what's going on. We're going to be able to check your bone levels, and so we can see if you're losing bone and get on top of that. There's some different procedures we can do that can help. We can't get bone back, but we can kind of prevent it from getting worse. And so it's very crucial to kind of keep on check on that. And of course, there's some things we can do for, again, for the low saliva flow. So there's things we can do to kind of manage these symptoms that people are having. So it's very important. Of course, if we catch things early on, it's much easier to get control of them and prevent some future problems.
You know,
And I
when you
would,
go around my mouth and measure 1, 2, 3, 4, whatever.
Uh-huh, uh-huh.
I don't know what that's
the
called.
gums, your the
Yeah.
gums,
Yeah,
right? Am
well,
I right, Jim? Am
I
I
had
right with
some
that?
Uh,
Yeah.
improvement from the
ah,
last time. I was
that's
real proud of myself. I did nothing and I improved. So
cool.
yay for me. Thank you.
Yeah.
I imagine as you're talking, it's hard for me not to say Jim, so
Uh,
Dr. Jim, that good oral health care is important. It's always important, but what I'm hearing is that it's even more important during the menopause transition as well because of all of the reasons that you just mentioned. So for our listeners, can you just recap some of the high level oral healthcare habits that we can all implement on a daily basis that will help with that calculus and that tartar buildup?
Sure. So, really, when it comes down to it, it's scraping the bacteria off your teeth. The bacteria is what's going to cause that acid production, which is going to cause the inflammation, which can lead to the bone loss or the cavities. So, we really need to get in there. The other thing, too, is that the lack of estrogen also makes the gums more responsive to that acid in an inflammatory response. So, it's really important to keep everything clean. So, definitely what you want to do is be brushing at least a couple times a day. Fluoridated toothpaste is going to be very, very helpful. And floss at least once a day. And what you're trying to do is basically scrape that bacteria off the teeth. It takes the bacteria about 24 hours to kind of regroup and cause that acid production again. So as long as you're getting in there and getting that clean, it should pretty much help with almost anything. You can also add in maybe a alcohol-free mouth rinse. You don't want to overdo it too much because then you can kill off some of the good bacteria.
Mm, Are you talking about like a Listerine or something like
Yeah,
that?
yeah.
Yeah.
Listerine with no alcohol is
What
best.
about a water pick? I hear about a water pick. I don't know. I don't
Yeah.
do it and I don't understand why I would.
Yeah, yeah. Water pick is great too. I mean, it's not the gold standard is still flossing. A lot of people think water picking, you can do that and you're going to get all your bacteria, but you're not going to get the same amount as you are with flossing. And so it's a great thing to add into your regimen, but it's not something that I would take and replace flossing or brushing with.
Okay. Thank you.
And
Yeah.
a hot topic that everyone asks questions about when you say the word menopause, everyone wants to talk about HRT, which we now call MHT. But how does hormone replacement therapy or menopausal hormone therapy come into play here with our oral health? Does it affect it positively, negatively? Is it neutral? Does it matter? Can you talk a little bit about that?
Yeah, that's a good question. So actually, it's funny. It's both. It's positive and negative, or can be. So there's some positive things. It can help increase saliva flow. So that's great that way. So it can help with bone density. for around the teeth. The negative side effects can be that sometimes you get an overgrowth of your gums, and that can make it a little bit harder to keep everything clean. So that's one. The other thing is they've seen that there's actually a little more plaque retention, so a little more plaque buildup with hormone replacement therapy. So again, being diligent about your hygiene and just managing the hormone levels and making sure that to kind of reduce those issues.
Yeah,
But
it makes
yeah,
sense. I mean, the general guideline with HRT is start off minimal, and if that alleviates symptoms, then you stop there and you don't need to increase, right? It's really about
exactly.
symptom management and not overdosing on
Yeah,
hormone replacement therapy. And it sounds like the same thing here. Do
I
you know,
do.
Dr. Jim, if it is uh, estrogen, progesterone, I mean, are we talking about one or the other? I know there are, some women are taking estrogen only. If we have a uterus, we're taking progesterone as well. Is it both, or is it mostly the estrogen that's causing that? Do you know?
Most of the stuff that I've seen is just estrogen. I haven't really seen any research about progesterone, but it's possible. I just haven't seen it. So most of the what I've seen is receptors are to estrogen.
Yeah, yeah.
Uh,
And I think we need more research in this area as well.
sure.
To that point, there's not enough research in general in women's health. So thank you for that. Yeah.
Uh,
So when we think about other risks that happen during this time in your mouth, or symptoms of aging, probably in most cases, does menopause increase the risk of developing oral cancer, or is there any prevention we can do about that? How do we have it monitored? I mean, I know that you look every time across my whole mouth to
mhm.
check, and I know you're probably looking for the overall health, but what happens in how to prevent it, and does it happen more during this time?
Yeah, no, there's no research that shows that it's any different, but because menopause is related to age, and so is cancer, prevalence of cancer is more related to getting older too. It's just kind of an important time or reminder to say, hey, let's keep an eye on that. And again, having your dental professional check, but you can also kind of look there yourself and make sure there's nothing abnormal or unusual. So I would say no, there's not really a link there that we know of. But of course, just the things that will help with oral health because of lack of estrogen are kind of the same things for cancer too, right? We want to stop smoking, good diet. So yeah, so a lot of that just kind of is the same. But as far as we know, not a correlation there.
That's good to know.
But I think it goes back to the regular checkups, seeing whoever it is that you see, whether it's you or someone else, those regular checkups are really important. And I know that you have diagnosed a lot of oral cancer with those regular checkups. So it is important to see your dentist on a regular basis.
Yeah.
And I know I'm overdue, Dr. Jim. So I am the
And
pot
The
calling
welcome
cobbler's
back.
shoes, right? The
here.
cobbler's kids have no shoes, whatever that saying.
Exactly.
Yeah.
Yeah.
Is there anything else that we haven't asked you that you would like to share with our audience?
Boy, I'm not that I can think of offhand. Again, I think you could have one of the symptoms, none of the symptoms, or all of the symptoms, and so I think it's good for women just to be aware of what the symptoms are, so that if they are having these issues, they can talk to their provider. For instance, if you're experiencing dry mouth, well, there again, it leads to a lot of oral health problems. So I think just making women aware of what those symptoms are is the most important thing.
Yeah,
Excellent.
you've done that. So we appreciate that because I don't think that a lot of people are talking about menopause and oral health, which is why we wanted to have you on. As you said, the mouth is the gateway to the rest of your body. So it's as
Mhm.
important as anything else. We always end each one of our episodes with a rapid fire. And because I know you so well, we've been married almost 31 years, I'm going to let Kim do the rapid round because I think I
All
might
right.
know all of the answers to these questions. So, Kim, I'm going to hand it over to
All
you.
right.
And
Well,
you fire
my
away.
first question's not rapid fire, but Dr. Jim, if people wanted to find you, where would they find you?
Oh, as far as Edmonds, Washington.
And like website,
I do have a
Twitter?
website,
Yeah.
James B. Haberman, DDS. Yeah.
Okay.
Uh-huh.
Great. Because when anyone asks me, do I have a dentist? You're it for me. So
Oh, thank you, Kate.
I know how to find you. Okay. Rapid fire. Are you ready?
Yes.
This is the fun part. And I told you we were going to have fun.
Okay.
So if you were to choose, would you want a picnic in the park or dinner at a restaurant?
I'd say dinner at a restaurant.
Okay. A fancy restaurant or a casual restaurant?
Casual.
Okay.
I
Would
want to
you?
answer these so bad, by the way. Like,
No, you don't get to. This is all me. All me.
I'm
Actually,
like, I
there's
know
one
the
on.
answer.
There's one not on here that I'm going to ask you because April and my answer is exactly the same on this. What's your favorite pizza topping?
Ooh, I would say pepperoni.
All right.
Pretty basic.
April and I both like mushrooms. So fine. Like pepperoni. Okay. You want to drive a convertible or a truck?
Ooh, a truck.
Okay.
And
Yeah.
you drive a truck.
Do you want to go camping or stay in a hotel?
Uh, it depends on the hotel, but I'd probably say hotel.
I don't think you're
fun,
gonna. I didn't say motel. I said
though.
hotel.
I'm
Yeah.
answering these questions based on my wife because I know she doesn't like to camp.
Oh, yeah. I'm gonna take her camping and golfing at some point. Don't worry.
Yeah.
Okay, good.
So we end our podcast with our rapid fire is different, but our final question every time is, what's the best piece of advice you've ever received, or
I
what's
was
the?
waiting. Yeah, I
Were
was
you waiting
waiting
for this
that
one?
one. Yeah.
Yeah.
Mhm.
Oh,
Okay.
good. Okay.
But what do you got?
Happy wife, happy life.
Oh, come on.
Touche.
How was that?
That was perfect.
Well, I love that answer.
Uh-huh. I knew it.
Is that your real answer, or do you have anything else in there, Jim?
Boy, that was the one I wanted to use. I didn't think of anything else.
It's perfect. I love it.
Okay. Yeah.
Yeah.
Well, it's been a pleasure having you on.
Thank you.
So
All
much,
right, thank
Dr.
you.
Jim, for joining us and for sharing your knowledge. We'll post your website on our episode notes. And until we meet again, audience members, go out and find joy in the journey. Take good care.
Thanks, Jim.
Thank you. Bye.